Hi, this is Ron from my clinic in Oliveira do Hospital in Eastern Portugal. And I want to spend the next few videos regarding different types of orthopedic pain. Today we're going to start with the simplest one of them all, which is knee pain. Then we're going to talk about back pain, shoulder, frozen shoulder pain, and so on. And if you have questions regarding other types of pains, I'll be more than happy to discuss them as well. I know it's going to come as a surprise, but most of the knee pains are not derived from the knee itself. Yes, I know you're going to go to a doctor and he or she will either prescribe an anti-inflammatory that in most cases are going to release some of the pain for a few days, but then the pain will return. And or you're going to be sent to do some more exams like x-rays and MRIs and CTs and so on. And the result is most of the time going to come the same. Well, your meniscus is so on and so forth, and you need an operation. Don't worry, it's an easy operation. But an operation is an operation is an operation, and it's never easy. I believe, from my experience, and I've seen hundreds and hundreds and hundreds of patients that came to me with knee pain, that most of the pain is not derived, as I said, from the knee itself. Most of it is derived from all kinds of soft tissues around the knee. And I want to differentiate between acute pain and chronic pain. When it comes to acute pain, I always ask for the story, how it started. And in many cases, I used to live in Ericeira, so I fixed many surfers and skaters. And in most cases, if you understand the surfing itself or the skating itself, you understand there's a motion or torsion of motion, or a motion of torsion actually. This movement of the knee itself. And the problem is, in 99% of the time, not the knee itself, but usually small muscles which are not developed enough or too tight that are pulling. And when they start pulling, the whole knee joint goes out of place. What I do in those cases, I look for those muscles. I look for the soft tissues which may be a bit more painful. In most cases, I'm going to find them above the knee. Again, in most cases, it's going to be in the inside of my my leg, and I'm going to go and push and try and see if I can find those places. And once I find the area which is going to be a bit more sore, then the treatment itself is very easy. Actually, I do many diagnostics like that from remote, because I don't even need needles in order to solve those issues. In most cases, I use a foam roller or just a roller from the kitchen, the one we use for baking. And I give some instructions, and if patients are willing to do some homework, it's a simple solution. So I saw many skaters and surfers, but I also see many runners and cyclists. And there it's exactly the same issue. It's usually a muscle or a group of muscles which are a bit more tight than others. And the solution in most cases is going to be to release those muscles. By the way, when I'm talking about muscles, I mean muscles and fascia as well. I do not differentiate here, because for me the treatment is going to be twofold. I'm going to prescribe a combination of stretching and rolling, which is going to take care of both of them. So in most cases, that's what I'm going to do with acute pain. When it comes to chronic pain, usually it's a bit more complicated, but not much. And I usually ask again to understand when it started, what started it, and in many cases it's going to be a big difference in strength and or a big difference in flexibility, hence range of motion of all kinds of muscles, and again, fascia around the legs and the knees. In some cases, it can actually be something that is derived from the lower back. And since the lower back is connected to the pelvic, and the pelvic is connected to the hamstrings, and the hamstrings are connected behind the knee, sometimes a pain that starts from the lower back can drive a pain in the knee. And I'm referring right now to orthopedic pain only. When it comes to chronic pain like a sciatic pain, which means that it's more neuropathic pain, hence more of a nervous system type of a pain, the solution in most cases is going to be lower back solution. And there I use needles in order to solve that. I use usually needles, a combination of needles and heat. But when it comes to, as I said, when it comes to acute pain, usually the solution is very simple. And unless we're talking about a big trauma, for example, you played soccer, football, and somebody kicked you in the leg, then it's a trauma. Then you may have torn your meniscus, your ACL, you may have a fracture, and things like that. But if this is not the story, this is not how the pain started, then it's not going to be a hard tissue or something that requires an operation. If you have any more questions, if you want to ask some more things,